And good afternoon to everyone joining us today. And we hope that your families and you are safe and well. We'd again like to welcome you to another webinar by the Indian Women in International Relations Forum. Today, we're excited to present a conversational style dialogue on research in migration, the data pandemic. I'm Jasmine Mehta, and I'm the co-chair of the Indian Women in International Relations Forum. I would like to actually, at the very onset, take a moment to share with you the vision of the IWIR Forum. But before I do so, just a very quick mandatory housekeeping plug-in. I would request all our attendees to keep their lines on mute. And the Q&A box on the right side of your Zoom screens will be enabled in about 30 minutes into the session. So please do leverage the chat box to ask your questions. Our speakers shall be taking those in the second half of the session. And we're also recording this session and live streaming it on social media. So back to IWIR, which is really a kind of a unique network of the Indian women and women of Indian origin, with a vision to really amplify the voices of women in the field of international relations, while challenging biases that prevent women, especially women of color, from being recognized as expert voices in the international relations and international political economy disciplines. Many Indian women and women of the Indian diaspora, which I may highlight as one of the largest diaspora in the world, have established some great milestones in the history of their disciplines through research, advocacy, or practice. And IWIR as a forum seeks to make a sustained attempt to bring such scholarship and scholars to the very forefront. IWIR also holds a vision with a call to action. So the forum seeks to leverage its network to mentor and provide career guidance to emerging talent among Indian women, both millennials and Gen Z, if you will, in the space of geopolitics and policy. But without further ado, I'd like to jump straight into today's topic of discussion on migration and research in migration. But if we take a step back, with more than 258 million migrants currently living outside their country of birth, and that number is of course expected to rise, the need for a common cooperative approach to migration has never been more urgent. And migrants who are entitled to the same fundamental freedom and human rights as all people often face dangerous conditions, fleeing conflict, persecution, poverty, or lack of opportunity. And often, once they reach a new community, are met with harmful misperceptions and resistance. While migration clearly presents a challenge that cannot be handled by one country alone for the transnational risk that it carries, it also presents many shared benefits and opportunities that are often overlooked. In 2018, the Global Compact on Migration sets forth 23 objectives for protecting migrants and better managing migration.
I think the screen is frozen on Jasmine's end.
National. Can you see me or hear me now?
Yeah, we can hear you now, Jasmine.
All right, sorry about that. So essentially, the goals of reducing risks during migrants or during the process of migration, and improving the collection of data and analysis on migration, and kind of really helps in fostering better conditions for them. And having laid out the macro scenario on migration, I think I'm very honored at this point to be able to present our distinguished speakers today, who shall indulge in a focused discussion on migration research in the light of data collection and challenges, and now the pandemic. So today I have Neha Dewan here, who is our co-chair and also the founding director of the IWIR Forum. Neha is an expert in international relations and security, focusing on South Asian politics, a program officer at the UNESCO Cluster Office for Bangladesh, Bhutan, Maldives, Nepal, India, and Sri Lanka. She's also a non-resident fellow and a political affairs officer at Global Policy Insights, which is also a project director for the Commonwealth Project, amongst her other affiliations. I also have a very special guest today, Emina Osmandžiković, and she is an expert on human rights, post-migration, and displacement. and big data analysis. For this work, she has worked with the UN, Herzegovina, and she's conducted her extensive field research on highly vulnerable refugee communities and returnees. And her regional focus includes the European Union and the Middle East, perhaps one of the most tensed regions in the course of migration. So with both these lovely ladies here on our session, I'd like to turn this over to Neha to connect and pick up on the conversational dialogue.
Thank you very much, Jasmine, and thank you very much for the warm welcome and introduction. And as Jasmine mentioned, the purpose of IWIR is to really amplify the voices of women like Emina herself, who are excellent and outstanding academics, experts in their field, and bring a lot of experience to the foray. So without much waiting anymore, I am so pleased to have my fellow Cantab, a dear friend, and an outstanding expert in migration research, Emina. And just to share a bit of the lay of the land for today's event, we'll commence with Emina sharing her expertise in the form of her presentation lecture briefly, and then we get into an actual conversation about some of the key challenges pertaining to migration, which have been amplified during COVID-19, the necessity for data, accessing data, and critically important, the question of ethical research in migration. And feel free to send in your messages in the chat box, especially we are completely aware that there are several young scholars wishing to take on the field of migration research, and we could not have found a better expert to start off this year with than Emina on this topic. So over to you, Emina, and we're very ready for your presentation.
Neha, thank you so much. Jasmine and everybody else, thank you so much. I feel deeply honored for being the first correspondent, if you will, in your series of events for 2021, and for the person really opening the series. I think that all of the topics that you tackle are very, very, I would say, fundamental, especially to young researchers, data analysts, people who are interested in IR, and anybody really interested in security, and any kind of global studies as well, and governance studies as well. So before I start my presentation, thank you so much for actually giving me this opportunity. I don't really consider myself, this grand expert, but I am an enthusiast and a great, I would say I have great respect and great passion for migration related issues, especially refugee related issues. So I feel deeply honored to talk about the topic today. So without any, I would say, further ado, I will share my screen. And all right, just to confirm, everybody can see my screen, right?
All good.
All right. Thank you so much. All right. So just to dive into the topic, the data pandemic discussion on research and migration is the name or the topic of today's discussion. And I would like to start by saying that the data pandemic on migration related issues has really been, I would say, very, very intrinsic within the field itself, even prior to the COVID-19 pandemic. So what we're discussing today is not a new novel phenomena that appeared last year or appeared at the beginning of this year. So it's something that's deeply ingrained in the studies and in the field itself. And a lot of experts and people within the field have been talking about this and have been urging national governments to actually revert and change and tackle more of this and understand why. What are the drivers and what are the key forces that are actually blocking people from getting access to data, and also blocking migrants, refugees, and all of the other people who are in need, and all of the populations in need who are vulnerable, from preventing them from actually getting access to data on, for example, healthcare services, access to data on integration, immigration, all of these other legal procedures. So we're not talking just about health, we're talking about this whole, I would say, umbrella lack of data within the field itself. So that's kind of my first starting point. And when it comes to the pandemic itself, I'll just, let me just kind of go to the next slide. All right, so the content itself, but before I dive into it, I would like to start very briefly with a story. I had the honor to talk to a couple of people from the field, including IOM, UNICEF, UNHCR, and the World Health Organization as well, very recently on COVID-19 and how it impacts vulnerable populations. So asylees, refugees, migrants, and other non-documented people, stateless populations as well. And one of them said, look, now some of the people who are in camps are actually, I would say, lucky because they're isolated from the national population, from the host country, and therefore they're at a lesser risk of getting COVID-19. However, many of them are actually, we don't know where they are, whether they are in urban settings, whether they're outside of camps, whether they're in dire conditions, especially, for example, in the Middle East, which hosts almost 1/3 of global migrants and refugees. A lot of these refugees, migrants find themselves not within camps, but also outside of camp settings, or in these kind of middle, in between a camp and an urban setting as well. So a lot of them would need access to data, but they don't have it in their own language, or they don't have access to healthcare services. So in order to get a test, for example, for COVID-19, you have to know where to get tested. How would you know where to get tested if you don't have access to that information in your own language, or even logistically, you cannot go to a center that offers testing? Now so data and information, language, and then the testing itself. And then on top of that, how would you know whether you're negative or positive? So how can you account for how many migrants and refugees and other vulnerable populations are there with COVID-19? How many of them end up in the hospital because of it, or end up getting treated somewhere in alternative healthcare centers because they cannot access hospitals because of their legal status in the country, for example. So that's just, I would say, a brief, not necessarily anecdote, but just a brief illustration of what the situation is today. So let me dive right into the known unknowns. And before that, just to say that some of these things I will discuss with Neha later on, and some of them I'll cover in the presentation itself. And it's a very short presentation, which is really there just to illustrate, I would say, scratch the surface of the topic itself. So the known unknowns, as I mentioned earlier, this data pandemic has been there in the field of migration even before COVID-19. And it's important to say, it's important really to state what the numbers are before we dive into the problematics of the topic at hand. So we have 272 million people who are migrants, and they include refugees, stateless people. They also include people on the front lines. So doctors, nurses, drivers, all of those who produce PPE and other healthcare related equipment in factories, in plants. So this number really covers a variety of people, and especially those who send remittances back home to their home countries. And remittances are one of the key, according to the World Bank, one of the key things that would actually get us out of the socioeconomic crisis caused by COVID-19 in the months to come, once the pandemic subsides. So it's important to have some numbers just as an illustration to start with. I keep clicking the wrong button, so I'm sorry for the noise that my computer produces. Now, I would say the complicating factor is COVID-19, yes. At the same time, it's not just COVID-19, because obviously you have a lot of countries that use COVID-19 to, for example, put more closures to their borders, and put more, I would say, strict rules in terms of who gets into the country, who remains in the country, who gets treated, who has free and unlimited access to healthcare as well, on one hand. On the other hand, you also have countries like, for example, Portugal, that brought in ad hoc measures to put this temporary protection on migrants and refugees and treat them equally to the nationals of the country. So you have a mixed, I would say, a mixed boat of things there. You also have a lot of countries like Malta, like Italy, who had this surge of migration across the Mediterranean at the beginning of the crisis. And then they would basically close down their ports and borders and blame it on the inability to exercise social and physical distancing. And that's why they would close, for example, ports and borders, the seaports. But they didn't really solve the actual problem, which is conflict in the origin countries of these people, right? So it's kind of delaying the response to the problem itself, and at the same time using COVID-19 to manipulate a lot of already difficult policies that have been there. So that obviously has been exacerbated by the fact that we don't know how many migrants died on the Mediterranean. We don't know how many migrants and refugees have had COVID-19. We don't know how many of them have access to testing. We don't really know how many of them left all of these reception centers, for example, across Europe, if we're talking about Europe, refugee camps, if we're talking about the Middle East, collective accommodation, if we're talking about certain parts of Asia. So that is coupled with this, I would say, image of immigrant doctors propelled in the media, saying, all of these immigrants and foreign-born people are rescuing us. They make between 15 and 33% of the healthcare force in certain developed countries and rich countries according to OECD standards. And for example, I think the World Bank has an estimate that 10% of migrants in work in key sectors, including healthcare around the world, but not just healthcare. We're talking about transport of PPE equipment. We're talking about, service industry as well. So you do have, again, a mixed picture that I just wanted to translate from the first slide to this slide as well, that kind of got a bit more mixed and a bit more complex with the pandemic itself. And at the same time, you have, as I said, these remittances that are a lifeline. According to, for example, the World Bank, it calls it an essential lifeline to many, many underdeveloped communities. And that is, they're predicting for it to shrink up by 14% by the end of 2021 if the pandemic keeps going the way it's going at this rate. Now, remittances, a lot of these communities depend on them to actually keep sustaining themselves with the lack of jobs, with general insecurity, with the increase in conflict, increase in domestic violence, and obviously poor healthcare infrastructure and other types of infrastructure that are really delaying any type of response to the pandemic by the governments of these origin countries where remittances are being sent to. So you even have, why I'm bringing this into the discussion is because you have this massive economic side effect of distorted migration patterns that we're seeing, coupled with the lack of data, coupled with the lack of recognition, and coupled with this, I would say, massive negative image in the media and lethargy by their host governments as well. So I would say with each slide, the picture keeps getting more and more complex and more complicated as I'm adding in the layer of labor, and then the economic, and then the socioeconomic, and then healthcare. So you see it kind of, and one of the UNHCR representatives in the Middle East, she, for example, called this the poverty pandemic for a lot of these migrants and refugees. And yet we don't really know its repercussions or its magnitude because we simply don't have any access to data. So that brings me to this is just a slide on one case study, which is the African continent in terms of the humanitarian response and the number of COVID-related deaths and cases that are identified there. Now, my free assessment there, my humble assessment would be that this is an understatement, that these numbers are really conservative estimates rather than a full situation of what actually is happening in humanitarian response situations. That's why I wanted to include the slide, because it complicates the situation further where you have active conflict as well. So there, in these cases, you can never tell and ascertain the actual number of deaths, positive cases, those that are treated, and those that died simply due to COVID-19. And I say simply here, obviously not trying to underscore or undermine anything, but just saying that it's such a complex, I would say, situation in many of these hard to reach areas as well, that we simply don't know and we might never know. And this is coupled now with a delayed response in terms of getting the vaccine in many of these developing countries. And even developed countries are still waiting for COVID-19 vaccines as well. So I would say overall, as I try to remain hopeful, the situation is very grim. And in terms of accessing that much needed data, I would say that we're going to have to wait for many more months to actually get a more clear picture of how much the pandemic actually impacted vulnerable communities. And I think this brings me to my last slide, which is that kind of expertise, ethics, and access to data between peace and war. We have a lot of these situations, even in developed countries, where, for example, The Guardian reported very recently about a refugee site in the UK being closed after many migrants there tested positive for COVID. There was a case in Bath as well, and a couple of cases in the Netherlands, in Belgium, in Germany, but all of these are very sporadic reports that don't really add up to the full picture. So you only hear about this, for example, from The Guardian, but not necessarily from official sources, not necessarily from the campsite itself. And it's very difficult to even access these people and access the data. How many of them were tested? Greece is, I would say, one beacon of hope in terms of the situation in Europe, because they are the country to report all of these cases and number of tests done almost on a monthly basis. So I would say Greece is one bright example when it comes to Europe and developed countries. In the Middle East, Jordan is another bright example that I have to mention before concluding the presentation, where the government has made official statements and efforts to actually say refugees will be vaccinated. So that's another bright example of refugees and vulnerable populations being explicitly mentioned. Germany would be another case in Europe where the officials said that in the second wave of vaccinations, they will include people in reception centers as well. So I had to mention these sporadic but successful and good examples of good practices. Talking about, going back to Jasmine's point and talking about that need for unified common cooperative approach. And I purposefully didn't want to mention COVAX here, because COVAX is a collaborative initiative between Gavi, WHO, and a lot of partners, including UNICEF, UNHCR, IOM, the World Bank as well, to provide vaccines to developed to underdeveloped developing countries. And 5% of their 2 billion doses are to be designated for refugees, migrants, and those in situations of humanitarian concern. However, they still haven't started distributing the vaccines and actually getting them to the countries that need them, let alone getting them to vulnerable populations, which is why there's a lot of questions there and very little data. So that's why I didn't want to mention it at this point, because it's all, I would say, at an ideational level still. So with that, I'll conclude the presentation, which kind of took longer than 10 minutes. So I apologize for that, but I just had to, I think, illustrate the urgency of the situation.
Thank you very much, Emina. I think that was an absolutely exceptional presentation. And more than anything, I think certainly it was an eye-opener, because at least in the whole of 2020, we've heard several narratives of, leave no one behind, no one is safe until everyone is safe. But what we don't realize is that this count of everyone and who constitutes this everyone is still missing a large part of the population. And I think you pointed out some very important distinctions in the layers that complicates the whole discussion around migration. There are, there's remittances, there are refugees, there are undocumented immigrants, and there's this whole complex interplay between all of these layers. But I think from a perspective of somebody who studies conflict, I think one key thing that I particularly found interesting was that it's not a new problem. At the end of the day, it is in many ways a structural problem. It's a consequence of structural violence. And I think that is what I want to be the starting point of our conversation, a bit about this long-standing issue, because I know you've been researching within the field of migration for several years now. So I really want to know what your starting point was, both from the perspective of your research, and secondly, how have those questions, those research questions, changed over time? Because I think in many ways that maps out how the field of migration studies and research and its trajectory has also changed over the years. So if we can, just hear from your experiences, hear your research starting points, and how different are those challenges? Because I would assume that the challenge of data, if anything, has probably become a lot worse over the years, but it would be interesting to hear it from you directly. So if you could start on that one.
For sure. Actually, that's a very, I would say it's a very good point, because and it's a very good question as well, because the field of migration itself is not static by any means. And as you rightfully identified, it's a structural problem of conflict that really propels a lot of migration and people movement. And it has only gotten worse over the years, not necessarily any better. And, when we try to solve one crisis point, there are three more that are, coming out and popping out. And so you keep trying to respond to these situations rather than have this proactive approach of how do we prevent people, or not necessarily prevent, but how do we foresee or think 1, 2, 3 steps ahead. So I think for me, as a young researcher, I've been involved in the field probably for around 8, 7 years now. And I started off as being Bosnian, being born during the war in Bosnia, having a lot of my family members as refugees. I naturally was very curious to understand what are these pathways that people take, sometimes forcibly, and how do they shape their lives, their integration into these different communities, and how do they map out these global patterns? Because the world truly is interconnected in ways that sometimes we can't even imagine. So that's how I started at the very, very beginning, doing a lot of I would say socio-political inquiries, surveys, starting with family members, later on expanding to friends of family, and then friends of friends. And then when I got into it more seriously, I actually started focusing on data itself, because I thought stories can tell you a lot, but in order to, I would say, generalize or attempt to discover wider patterns, I wanted to focus on data as my second step. And with that, we had the emergence of the Syrian conflict, and then Libyan conflict, and then obviously the conflict in Yemen, and this massive migration of people. And that, I think, begged for more questions. And are these crises different from one another? Do they require the same solution? What is this common unified global approach, and can we apply it to every single situation in the same manner? So there's also this one, I would say, concept that I draw from psychology, which is kind of when you have many people fixing the same problem, it never gets fixed, right? Or I think even more in psychological theory, the bystander effect, kind of everybody else is expecting everybody else to help. But so do you localize a solution? Do you regionalize it? Or do you actually escalate it so that, the world powers can solve it? And even that now, for example, if you're waiting for a lot of world powers to solve it, say, for example, Europe, they have had a very bad track record of solving the issues in the origin countries of a lot of migrants. So what they focus on is their immediate neighborhood. So they're not even responsive to this structural problem of conflict, as you called it. So even going back to that and now applying it to COVID-19 and studying how a public healthcare crisis actually affects migration, you see a lot of countries that are struggling even with their own population. And they're expecting the international community, NGOs, organizations, and other more developed governments to actually jump in, save the day, and facilitate vaccination. And so you have even that, right, where a lot of these NGOs now had to transform their work to be healthcare providers, sometimes even primary healthcare providers for these vulnerable communities. So UNICEF in Syria is one example. So it's such a, I would say you're right, that my path as a young researcher evolved with the emergence of these new crises, and then with these questions of how can we escalate, how can we compare, how can we, if we fix this problem, is the same solution applicable to 10 other problems? How do we localize? And yet, how do we actually combine a bit of global into that local solution? So those are the kind of questions that echo in my path, I would say, so far.
Thank you very much, Emina. I think I think the key idea there is about responsibility in many ways, and especially responsibilities in the scenario where the sort of home government isn't really able to take care of its populations, or as we sort of popularize it in IRs, the responsibility to protect, when the state itself is failing and when the conflict situation in the home country is really bad. Is it the duty of say liberal democratic governments in Europe or the rest of the Western world, or do they sort of relegate this responsibility off to international organizations? And I think IGOs are the ones that I want to talk to you a little more about, because of course you've interviewed leading experts from IOM, from the WHO, and you've also had some experience working with the UNHCR. So from that ground perspective, what are the challenges, and rather what is the natural stopping point for these organizations? Or in a more utopian sense, where does the problem really lie? Why are we still not able to solve such crises? And I think in the same line, there's another second question I want to ask you, because both you and I together wrote about COVID-19 in Africa at the very outset of the pandemic. And I think one of the realizations, as you also pointed out, was that the burden on international organizations really increased, because somehow it's these these amalgamations of IGOs where the burden really lies, though there is no link of citizenship or political obligation in that sense. So if you could touch on those two themes for us, please.
For sure. And I think in terms of my experience, just to kind of start with that, there's always been the struggle of, obviously, a lot of these international organizations have been invited by their host governments and host countries. And they have always very closely worked with their host governments. So I think they always have to strike this balance between, we don't want to overstep the generosity and the welcome by the host government, and at the same time we see all of these populations that need to be helped, and yet the government just cannot. It doesn't have the capacity, the logistics, the infrastructure, the manpower, sometimes even the knowledge, if it's a new crisis that involves a lot of new factors that the government is simply not prepared to tackle. Or sometimes you have a government that simply doesn't have that branch in any of its ministries, for example, developed to deal with any of the crisis, or for example, refugee camps, or any type of import of PPE, say, for example, when we're talking about COVID. So a lot of these organizations then kind of have to strike a balance. We want to work together with the host government and actually, I would say, empower them, enable them. But at the same time, we see that they are unable. So sometimes we have to jump in and actually do the thing on our own, especially if the government is very fragile, doesn't have the trust of the population. or just simply is just started, is a transitional government, or, you know, is still marred in conflict. So a lot of these situations, obviously, it's such a push and pull and me having worked with some of these organizations, having collaborated with them on the ground, they're always very, very careful, you know, not to overstep the kind of the purview of the host government. So I think that's one major thing to take into consideration. And yet now with COVID, a lot of these host governments are saying, oh no, well, we're expecting of you to solve it. We're expecting of you to facilitate the vaccine because we can't. So there is this expectation as well that builds on top of this hesitancy. At the same time, on the ground, from what I understood, is that there's a lot of misinformation about COVID-19 vaccines, this and that. And a lot of these organizations are trying to, you know, push out these information campaigns. And in that, they can't rely on the infrastructure given to them by the government, by the host government, because sometimes it's simply not there to actually educate local communities. At the same time, in terms of logistics, I actually had a good conversation with UNICEF in Jordan for one of my research projects. And they mentioned that for a lot of, say, PPE and whatnot that they purchased, they would purchase it from local or regional producers so that they actually contribute back to the local and regional economy, which is something that the governments would not necessarily do or wouldn't necessarily have in their mandate. So you see kind of the difference even in the way they conduct business there. So as a researcher myself, I was thinking, okay, so would then these vulnerable populations give more trust to these international organizations such as IOM, such as UNHCR, UNICEF? And I would say, from what I understood and from my own experience, yes, I would think that they would give more trust to these organizations than sometimes to government representatives. So I think, yeah, so just to kind of answer the question there.
Thanks very much, Emina. And once again, just a reminder to our audience to please stay on mute and also send in your questions through the chat box, which we will be taking very soon. But Emina, I think a very topical question, if I may, is that now that, and it has to be mentioned because Biden is now officially president, he's made it to the other side. And I think because one of the key changes, or rather two important changes from the long list that happened on day one. One was the lifting of the ban on several Muslim countries, and in terms of the travel ban. And the second was regarding the 2020 US Census and actually including undocumented immigration populations in those statistics. So if just you could really talk about the value of these two major changes, especially the latter half, because at the end of the day, that's a very key input, a key impetus into reading statistics and data, because they obviously affect the kind of federal funding which goes into healthcare and other facilities. So do you think there will be a big change, an exciting change that we should be looking forward to? Or do you think it's more as a name value? So just your thoughts on that.
Well, anything that involves data, I definitely think is very, I would say, always welcome. So even if it means just mapping out who is in need, who needs to be helped, and how do you actually navigate from an undocumented status or, you know, a legal resident to all the way to a citizen or somebody, for example, with the green card when it comes to the US. I think all of these decisions are steps towards the right, I would say the right situation, or correcting, or, you know, correcting the wrongs that have been done. Now, I don't want to say that I'm for or against any US administration, but I would definitely say that the past 4 years have been more conservative when it comes to immigration policies. And just from a researcher point of view, a lot of people have been hurt by them. So taking a step back from today's and yesterday's decisions, when you look at the past 4 years, they really tried to undermine and delete a long history that the US has had with positive immigration laws and commitments. And because the US in general, I would say, really is a good and bright example of data, especially on migrants, foreign-born experts, even when it comes to, for example, within the educational sector, they have allowed those who are undocumented to register for universities. And there are separate registries on that, even by county level, sometimes even by city level. So you really, really have a wealth of data coming from the states that actually has enabled a lot of these issues to be studied. You also have a lot of good research from Stanford, I would say Stanford Immigration Lab, and they had this model even developed on what is the most optimal way to allocate refugees coming into the States. You know, how do you actually fill their data into a system and then get an algorithm to actually calculate where they would integrate best? So these are the things coming from the States, right? So there are a lot of these really good initiatives that I think paved the way to these decisions that have been brought in the presidential decision yesterday and the day before, that obviously I welcome as a researcher, because I think that the more you know, the more you can do later on. Because I think one of my first points at the beginning was, if these people are not registered, if they're not tested, you don't know how many COVID cases there are among them. You don't know how you can help them. And you don't know how many die because of COVID. So, and you simply don't know even how many of them need to be given the vaccine, et cetera. So I think documenting them, registering them, enabling them access, welcoming them, I think are the fundamental first steps in helping them and making them a part of these national efforts to actually vaccinate and I would say cut the lifeline of the pandemic. So I would say that's my comment, just kind of going back, looking at a bigger picture, and then coming back to today and this moment. It's a brilliant first step, and it makes me more hopeful that other countries in the world are going to do the same. Another, I would say, equivalent case is Germany in Europe, that has done a lot. Portugal as well, with citizenship policies and relaxing laws as well for its migrants and refugees, just to name a few countries that have really done a lot of good because of the pandemic. So yeah.
Absolutely. Emina, I think just on that, based on what you said, I think I was reminded of this big WHO survey, which was, I think, released last December on International Migrants Day. And I think it was an evaluation of some 30,000 refugees and migrant populations around the world. And I think it surveyed the impact that these refugees had felt on their mental, physical well-being, also their ability to support themselves, etc. And I think the average sort of impact on a scale, a linear scale that they had found was that it was leaning towards the extreme. It was about 7.5 average from a 0 to 10 scale. And I think that really shows the extent of the problem. That, of course, one part of the problem is the question of vaccine, the impact on physical well-being, all of the key things that you've raised in the last few minutes itself, but there's also the impact on mental well-being, the capacity of these populations to sustain themselves and integrate, assimilate, etc. So I think what I'm really trying to understand is whether, is it too late? Are we already leaning towards a different angle, a different aspect of the humanitarian crisis? And that's added with the fact that we don't know when these populations will actually receive these vaccines, which is something, a point that you underscored at the very outset. So even if there are these efforts which are absolutely laudatory, is it a bit too late? Are we already at a point of no return? So just your thoughts on that.
I think that's a brilliant way of giving an overview of the current situation. And I think you reminded me about a survey being conducted in Lebanon, for example, to just zone and in one region, right? In the Middle East, Lebanon hosts a couple of millions of refugees, not just Palestinian historically, but also Syrian. And they had this survey as early as July last year, so only a couple of months into the pandemic, where the short-term impact of the pandemic on refugees has been so dramatic, where just to read a couple of numbers, 26% were unable to buy medication. 61% lost their jobs. Now, whether we're talking about, legal or illegal, or, kind of on the black market and whatnot, 77% had difficulty buying food. So when the UNHCR regional representative that I spoke to a couple of times labeled this poverty pandemic, she truly meant it, as early as a couple of months into the pandemic for these vulnerable populations. So I think the WHO survey from December last year, I think it brilliantly illustrated how drastic their state deteriorated because of the pandemic, but also because of all of the other things that just completely stopped in their host countries, given the pandemic. You had a lot of import difficulties, delays, bans, a lot of enclosement of national governments, a lot of focus on their national populations, which is rightfully so. Like, I'm not saying at this point that that's a bad decision from any one party, but there was a prioritization that simply didn't include refugees and migrants in national plans and national recovery strategies, except in a few countries that I named that really stand as a shimmer of hope in this, I would say, very, very bleak situation. So I think that the WHO really exemplified that not only is it bleak, but it is going to get worse in 2021. And we are in 2021 at the very beginning, still no vaccine being distributed in a lot of countries around the world. And within that, the 5% from the COVAX facility that is WHO coordinated activity, it still has an uncertain start date for a lot of these populations, and there's no alternative. So I think a lot of these surveys are good in mapping out just how severe and serious the situation is. But at the same time, they're saying that, look, these populations have no alternative. So how can we get access, how can we get them access to anything if we simply don't know where they are, what the difficulty is, how many of them need help, So I think it's doing surveys is brilliant as a snapshot into how much the situation has worsened from January, February last year when WHO proclaimed this a global pandemic.
Yes. Thank you, Emina. That was it was an absolutely fitting and a brilliant response. It is definitely a very, very big challenge to quantify the crisis, but I think your understanding of what these surveys mean is certainly very helpful to me and to our audience. And on that note, I think I do want to bring in some of the questions which have been coming along the way. I think you ended that answer on the note of access, and I think I have a question from Kyle Marston. I hope I've pronounced that correctly, but the question pertains to what were the barriers you faced in your data collection process, particularly due to language barriers. So what were the challenges you had, or how, even for us all, how important is it to not have that language barrier while working, especially with vulnerable refugee populations?
I think that's brilliant because I was able to do a lot of field work in, I would say, for example, looking into the EU, Sweden, Germany, Spain, and France, and then in the Middle East, I would say Jordan, Saudi Arabia, Lebanon to an extent. So I think obviously language barrier, there has been an issue sometimes. So that's why me personally, I decided to learn Arabic, because a lot of the refugees and migrants do come from the Middle East. Unfortunately, there are a lot of word I mean, obviously war-torn countries and conflict-affected areas. So, and that is true that there are many, many Arabic dialects. So I started with the classical Arabic. And then when I lived in Jordan, I picked up a lot of the accent there, and I tried to really immerse myself in the community. I also, for example, in Saudi Arabia, when I did a lot of research, I had a lot of people helping me who are Saudi. In Jordan as well, I had a lot of people helping me who are Jordanian. So I think bringing in local researchers from the area, I think also gives a lot of legitimacy and credibility to your studies and to your research, no matter what you're doing. And this goes beyond the migration field. I am a believer in transparency of processes, in trying to learn the language if you can, and in involving local populations as co-researchers, co-authors, or research assistants, or people who can be mentors, advisors, proofreaders. So there is this whole layer of this whole team of people that you can involve in your research to make it more ethical, more credible, and more understanding of the local population, even if you're not from the region or from the country itself. Because I think that's kind of just to respond. And obviously there have been a lot of difficulties. Me with Arabic, I still am learning every single day, but I am able to read, to write, to hold conversations, to do interviews in Arabic. So it has helped a lot in kind of clearing out the need for a translator or for a mediator between me and the people I want to interview.
Thanks again, Emina. I think absolutely, because there are, while it is a complicated field and discipline to study in itself from a theoretical perspective, from a practical perspective, I think the questions of doing research ethically, and even the costs of research, the safety surrounding research, and particularly working with vulnerable populations can be so important. So thank you for sharing almost that ethnographic researcher's perspective from all of your vast experience. And I think there are two questions that I have, which pertain to pretty much to the idea of integration of refugees. And one of them is from Javaria Najib, who is giving us the example of Pakistan, which of course has a large number of refugees coming in from the crisis or the conflict in Afghanistan. And I think what she's trying to share with us, or he's trying to share with us, is this idea that several underdeveloped or least developing or even developing countries might resort to giving nationalities just so that they don't have to deal with the cohort of challenges that come with the terminology of having refugee populations itself. But I think just to extend that into a question further, do you think the answer is as simple as as giving citizenship? And I think it was very interesting because recently, and as you also mentioned, even France gave out or accelerated the citizenship process for immigrants. And while it seems on the one hand as a great thing to do, on the other hand, it can almost perpetuate this idea that to be able to get an accelerated citizenship, you have to be an outstanding citizen. Although almost you have to be, a frontline worker, a doctor as an immigrant, and then, by serving this country, you become one of its citizens. But I mean, of course, these are some controversial discussions and there is no easy answer. But what are your thoughts on the citizenship as the solution aspect?
I think that UNHCR classifies, so for example, the situation of refugees from Afghanistan in Pakistan, even in Iran to an extent, it's called protracted asylum, protracted. So they're in this state for decades. I think a lot of them have integrated to an extent. In certain situations, the language is very similar, so it's a bit more difficult if the language is completely different, if the country is not necessarily a neighbor. Then you kind of have to break it down into these categories and components. So I definitely don't think that citizenship is, the simple, clean solution. because I think it misses a lot of that. Every immigrant has a story, whether they are a refugee, whether they're an asylee, whether they are simply an economic immigrant, a labor migrant, a stateless person who then later on gets an official status. Every single person who crosses borders in order to seek a better life has a story. Now, whether that story is accepted by the host country, whether that's seen as legitimate, is a different story. So I think having citizenship obviously brings a lot of other perks and other benefits, right? Access to, for example, universal healthcare in some countries, or that security of maintaining a status and staying in the country without the fear of being pushed away, prosecuted, or just kind of ostracized from the community. So I think it allows also for a lot of socioeconomic perks as well, like free education, and for your kids, if they're born there, to have a legal status from the very first day of since they're born. So I think citizenship in many ways is the solution, but I would say that it fails to illustrate the entire integration process and that journey and the story and the constant push and pull between the host community and the immigrant community as well. So that's one. And then obviously, I think it doesn't necessarily encapsulate that diasporic connection as well with the origin country either. So there is that concept that includes a lot of international relations, security studies, socioeconomics as well, sociology, obviously. So I think there's a whole layer there that you can't necessarily all compress into, okay, he got citizenship, thank you so much, goodbye. But obviously it's a good thing if citizenship is obtained at the end, of course, because it does bring a lot of good things as well with it. And I think the other example that you mentioned, France, just to kind of briefly touch on that, a lot of countries in the developed world would want highly skilled, highly educated migrants. So I think there is that skewed, demand for people with PhDs, for people who are doctors, for people with high-level degrees, that doesn't necessarily actually illustrate the need of the market itself. So I think there are incongruences there between what the economic demand is and what the political pressure is. Although I definitely, at the end of the day, welcome these citizenships to healthcare and frontline workers for sure, especially now.
Thanks, Emina. I think that's a very refreshing insight and a different depth of insight altogether. And I think I do want to pick up on the idea of the state there, continue it with a question we received from Malika Sinha. And I think her question really is about the state side and mostly the capacity building of the states, because while of course we understand and we empathize with particularly the migrant or refugee experience, what from your understanding or experience, what goes on with the states? Are there good examples of state capacity building? Because there are limits for the state itself, right? And there are duties towards its first citizens and then international community. So how do we deal with the idea of the limits or the limits on capacities of the state, and particularly on the concept of capacity building for states to intake migrant populations and also give them good livable standards? So just your thoughts on that.
I think, many migrants and refugees, and in no way do I mean to compress them into one category, but just to illustrate a point, I think many of them do live in countries that are struggling to provide their own populations with the basic healthcare, socioeconomic coverage, educational assistance, etc. So I think it would be almost unethical to say, the question of, okay, prioritize all of these people over your national population. So a lot of times, there is this debate, where do you strike the line between, if you can, let's say, vaccinate a certain amount of people in your country and the vaccine capacity that you have cannot cover everybody. how do you include refugees and migrants when you can't even vaccinate your entire population? So there is this pressure on governments as well to perform, and this capacity building that we're talking about and mentioning also involves a lot of underdeveloped infrastructure. Even in developed countries of Europe, you have a lot of counties and a lot of regions that don't necessarily have the healthcare infrastructure, that don't necessarily have the bed capacity, even for their own populations, let alone to host migrants, refugees, and all of those in reception centers and collective accommodation centers, and a lot of those who come across the border in the midst of the crisis. So, and then you simply don't have the manpower. So many even developed countries have had these international calls for nurses, for caretakers, for doctors, for immunologists. Just that tells you that there's this incredible amount of pressure on governments to perform, to take care of their own population, and then everybody else comes after. So you see this increase in, I would say, nationalism as well. To an extent, you see a lot of countries not relying on international instruments, but relying on their own capacity and really enclosement. And obviously, they are, especially when we're talking about democracies, obviously responsible and responsive and accountable to their own constituencies. So that brings another layer of who do you respond to at the end of the day? And who is going to vote you out of office in 4 years, or who is going to keep you in the office. So who do you focus on, right? Because a lot of migrants and refugees don't have the right to vote on many issues, especially on political candidates who later on make these policies and become policymakers. So I would say that it's very complicated. So it's not as simple as saying they have to be included in national vaccination plans if we're talking about COVID-19, or they have to be included in universal healthcare coverage, or in Obamacare when we're talking about the states. Or it's not as easy as saying that, because it might not be in the immediate interest of the government that's simply trying to optimize the limited strain capacity it already has.
Thank you, Emina. I think definitely lots of things for us to think about. But I think the final question from my end, or rather a request for a comment, would be that for our audiences here or on Facebook, and I think this is really the opportunity in a world full of misinformation, what's the one takeaway that you want us to, go back with from this virtual platform, especially in our thinking about the whole problem? Because I think one of the major reasons why we have this event is to look at long-standing issues, but with a renewed vigor, and secondly, with a new perspective. So what's that one thing that as a takeaway message you'd want to share with us?
First of all, I would like to thank you for this opportunity to discuss this topic that I think is one of the defining topics of the 21st century, of not only the past decade, but I think for many more decades to come. I think the world is always going to have migrants, and whether they're forced or whether they're labor and economic migrants, I think that that's going to be a part of the human condition going into the future, especially in the post-pandemic period. So I would say if there's one takeaway for people who are open-minded, people who are curious, people who are young researchers like yourself, like me, who are very eager to tackle these issues, to talk about them, I think one takeaway would be to always try to discover more, always try to ask questions, always try to understand, if there's any misinformation or lack of data. Why do we have lack of data? Why do we have misinformation? How can we address it? And who can we work with to address it on a local, regional, global level? Because this Zoom conversation that we're having, I think even if it makes a difference in one other person, we've already succeeded in changing somebody's mindset and making them more curious, and actually making them ask better questions when they're reading the newspaper tomorrow. So I think these little steps is the best we can do until we become policymakers ourselves. So that's just to stay curious and just to stay vigilant. And I think summing up the point with what you brought up is the original quote from the head of the World Health Organization is, nobody's safe until everybody's safe. So including even those who are hard to reach and vulnerable, I think will be important in the months to come.
Thanks, Emina. I think definitely, if that's the metric of our success today, we've definitely had a resounding success for from this event, because I think you've definitely left behind a lot of things to think about, a lot of curiosities, and I think I can think of welcoming you back to IWR events again, just to talk about the idea of representation, how the dynamic around voting changes, the economics of integration, and there's just so much that is still in the unknown. And I think that was a key starting point for us, knowing a little more about all of these unknowns. So thank you once again. And I think just from our side, I think I'm really reminded of Jericho's artwork, the raft of the Medusa. And I think that imagery was so poignant back in the early 19th century. And it still is a reminder of how the crisis has stayed on. It's nothing new, and how it will continue to stay on. But it's really upon us, the onus is with us to change our perspectives of thinking and doing little by little about it, particularly to have an inclusive policy and wherever we are. So thank you so much for bringing this wealth of knowledge to us. And I invite all our audience, which I also thank for being here today on a Saturday in the evening or morning, wherever you are. Please do read a lot of Emina's work, not just some of it, because it truly is brilliant. It's refreshing, and it's the work of an incredible scholar. And we're so lucky to have opened this year with her. So please do familiarize yourself with some of her research. Do follow IWIR. And I also thank Jasmine and my team for supporting and organizing this event. So thank you very much, Emina and everyone else. And we hope to see you all again soon. Thank you, everyone. Thanks again, Emina.
Thank you.